So let's talk about the non-surgical options that we have. We already mentioned briefly the medical supervised weight loss program, but we're going to take this opportunity to talk about the gastric balloon procedure specifically. So the gastric balloon procedure is a endoscopic procedure. It's performed via a specialized camera that is placed in the stomach from the mouth, and we place a soft silicone device that will give the patient support for weight loss. So the balloon is positioned under direct visualization by the professional. It is inserted in a deflated fashion, and once in the stomach, we inflate it with a liquid solution, which we're actually looking at the balloon as it feels before it is deployed. It will help the patient by providing satiety, control of the portion, and a change in the hunger feeling. The main advantage of the gastric balloon is that it's non-surgical. It doesn't cause any pain. It doesn't have any incisions or cuts or scars. Most people lose 2 to 3 times more weight with the gastric balloon than with diet and exercise alone. It doesn't cause any permanent changes in your anatomy. It doesn't cause any permanent changes in your stomach. One of the disadvantages of the balloon is that it can cause uncomfortable sensations in some patients, including nausea, vomiting, or pain. But luckily, we are able to control most of those symptoms with medications during the course of the treatment. Another disadvantage that the balloon may have is a weight regain if the patient is not able to follow the guidance that we give them during a 1-year period of the procedure. There have been reported other side effects from the balloon, which are in an incidence of less than 0.05%. So it makes the gastric balloon an ideal procedure because it's extremely safe. A disadvantage of the gastric balloon procedure as of today is that you cannot get insurance coverage for it. So it has to be a private self-pay procedure. Prior to the insertion of the gastric balloon, we do a thorough examination of the stomach to determine that it is appropriate for the balloon placement. There are many things that could make a patient not a balloon candidate. One of them is any structural changes in the stomach, any previous stomach surgeries, or severe symptoms of gastric reflux disease. And that is because the balloon will become non-tolerable. If the patient also has many medical conditions and is deemed to be very sick, it's probably not a right balloon candidate. So the gastric balloon is FDA approved as a successful therapy for weight loss. And as such, it has also restrictions for certain individualized patients. So we discuss the specific during a consultation because we need to understand first the patient prior to describing whether the patient is a good balloon candidate. The gastric balloon has been around for several decades, more than 20-30 years, and more than 40,000 patients treated with it. So it makes the therapy a very well-known therapy. The balloon is an ideal procedure for patients that is looking to lose anywhere between 20 and 50 pounds. That being said, we've had patients that have lost more than that, or patients that have stayed right around that average. Most patients for a gastric balloon need to have a body mass index between 30 and 40, which will put them into the category of obesity class 1 or 2. The patient also needs to be able to follow the guidance of a medically supervised weight loss program and nutritional support to be successful. The price range for a gastric balloon procedure that includes placement, removal, and nutritional program with the appropriate follow-ups may range anywhere between $6,000 and $10,000. We do have one of the most affordable programs there is in the nation.